Good afternoon. Welcome to the daily briefing at the St. Clair County EMA office, where I'm joined by Chairman Mark Kern. And today, happy to say we have Deputy Director from the Health Department, Mila Blanford. Mila, thank you for joining us today.
Thank you for having me. So for Wednesday, August the 12th, we have a total of 1,122 total new tests, 66 of which were positive. 42 of those are under the age of 40 years old. The age range goes from under 10 all the way to 80s, and that consists of males and females. The county positivity rate is at 5.9%, and the regional positivity rate was at 7.5% as of August 9th. And we are happy to announce there are 0 new deaths for today. So that is the good news. Countywide, we've conducted a total of 46,805 tests, which 4,584 were positives, 42,221 were negative. And the total deaths to date were 158, and our sympathies to those families. To date, the number of individuals who have completed their 10-day isolation period is 3,749 individuals. Statewide, we have tested 3,189,801 tests for a positive of 198,593 tests, and that's an increase of 1,645 from yesterday. Total deaths throughout the state were 7,672, and unfortunately that's an increase of 16 from yesterday's statistics. For hospitalization numbers, the number of COVID-related hospitalized patients is 49, and that's an increase of 8 from yesterday's report, and we have 1 patient on a ventilator. We are also happy to announce that there are no new cases in congregate care settings. So another positive for today.
That's good news.
Yes.
Well, we like negatives better than positives mostly, but a positive is a good thing here.
True. Okay. As far as testing, I think everyone is familiar with the fact that St. Clair County Health Department has partnered with SIHF as well as IDPH to provide the community-based testing. There is also a graphic that EMA will provide for Mass and County testing that's available locally. Tomorrow we will be at Mascoutah at the Chevy Park. It's at the Ag Building. We've been there recently. The reason we selected to go back there again tomorrow is because we do anticipate there may be some weather, so we wanted people to have a covered location. The time will be 10 to 12 and then 1 to 3, and that is a walk-up clinic. Monday, August 17th, we'll be at Shiloh Community Park from 8 to 4, and that's a drive-through. On Tuesday, August the 18th, we'll be at Belleville West High School from 8 to 4, and that is also a drive-up. And there's some special instructions for directions there when you go to the second light and make a right and then follow the signs. And it helps facilitate their traffic flow. Friday, August the 21st, we'll be at Fairview Heights Moody Park from 8 to 4, and that is also a drive-through. And then Chairman Kern, are you ready for your zip code report?
I am. So, the increased testing, the purpose of that is to find this virus, to find the enemy, and isolate it.
Right.
And that's why we're out, and we're trying to go remotely to as many places as we can. We encourage everyone to get out and get tested and make sure that you don't have the virus because you don't really know sometimes.
That's correct.
You can be asymptomatic. And asymptomatic basically means you have it, but at the same time, you don't feel symptoms. So you can still shed that virus even without symptoms.
Right, and we go back 48 hours prior to someone developing symptoms to talk about who their close contacts were. So that's why it's important, if you've had an exposure, if you're out being tested, you want to stay home until you receive those test results. We don't want people out feeling well and then spreading it in the community.
And so really keeping a diary of who you're with on certain days or every day, just jot a couple notes down may help if you do contract the virus. And you're in charge of the contact tracing, aren't you, at the health department?
I am. We're in the process of hiring more contact tracers because, obviously this is going to be a long-term solution. So we have a staff that we're onboarding in order to meet all the requirements that in the caseload that we do have, unfortunately.
Well, Mila, we appreciate you being there and doing that. That's making a big difference in the fight to end COVID.
That's correct.
Okay. Well, we'll move into the zip codes. Unfortunately, today we see some increase in most of the zip codes, so you'll be hearing the entire line of zip codes today. In 62059, we remain at 10 COVID positives in that zip code. 62201, we go up by 1 today to 193. 62203 remains the same at 163. 62204 remains the same at 121. 62205 goes up by 2 to 167. 62206 goes up by 1 to 363. 62207 goes up by 3 to 214. 62208 goes up by 4 today to 293. 62220 goes up by 4 to 373. 62221 goes up by 5 to 411. 62223 goes up by 1 to 222. 62225 goes up by 1 to 19. 62226 goes up by 5 to 475. 62232 goes up by 3 to 99. 62239 goes up by 1 to 56. 62240 goes up by 2 to 19. 62243 remains the same at 34. 62254 goes up by 3 to 136. 62255 stays the same at 13. 62257 stays the same at 25. 62258 goes up by 1 to 77. 62260 goes up by 1 to 71. 62264 remains the same at 71. 62269 goes up by 7 today to 336. And 62285 goes up by 2 to 47. Herb?
It's another day of numbers. As you and Milo said, they're okay, but they're not great. The 3-day positivity rate went up another point. It was 7.4 yesterday. That's the one as I say every day, I watch that one, because if we get 3 consecutive days of that, then we're going to be looking at a different ball game.
And it seems like our county, our numbers are, knock on wood, our daily positivity rate has been less than that 10% average that we saw throughout June and July. That's a good thing, but I think the surrounding counties around us now are experiencing rising rates. So,
Which has an effect.
That's why we saw our number go up to 7.5 today. From yesterday, it was 7.4.
Right. So, as I said yesterday, it's a roller coaster. I'm just looking for the ride to get down at the bottom and stay there. I don't like it when it starts going up, but I'm really happy with Team St. Clair. All of you who share this briefing to your friends, family. We're seeing more and more county residents. I had calls this morning from people in Madison County saying they were going to tune in today. One of them was a friend of mine, Luke. As a school teacher, and concerned about what's going on with the schools, some of them starting back up. And we reiterated yesterday that the school districts had to put a plan together, and we got to rely on our administrators and our teachers, and of course the parents had a lot to say in those surveys that were sent out. And everybody wants the kids in school, but we want them to be safe. And if you look around the country, some of the schools that had started up a week or two ago have experienced some problems. Some of them haven't. So, as we said from day one, this is every minute of the day, every hour of the day, it's changing. And we're living proof of that. This is our 152nd day, I believe, we've been doing the briefings. And I'd like to say it was the last one, but unfortunately, until the chairman says it's the last one, we'll still be here.
I think we got a ways to go. In Highland today, we heard on the news that a teacher there.
Yeah, during the sessions for the staff had tested, and so we're watching all of that, and of course amongst that we get flooding today, and so EMA has been busy. For those of you out there traveling, we try to post up as much of those road closures that we could, and just the message we say that turn around, don't drown. And because some of the pictures that people sent in was cars driving through that water, as I showed you, and that's not a good decision. So it was nice, no deaths to report in the county, but statewide 16, and that's way too many. And so we're gonna continue to push. We need you, each and every one of you, to be on Team St. Clair and make sure, wear the mask, wash the hands, practice the social distancing, be a part of the solution, not the problem. As we say all the time too, we want our businesses open, we want to be able to go to the stores, we want to be able to go to the restaurants, but we have to be responsible, and that's on each and every one of us. It's not not just any one group of people. It's each and every individual has to take responsibility for their actions, and you do that by doing those simple 3 W's, and we will get through this.
You know, so we hear there's a state representative from down south who keeps trying to say that putting rules and requiring masks isn't a good thing. It is a good thing to encourage people to wear masks, to have them wear masks when they're out in businesses. Probably tomorrow, the state of Illinois will hit 200,000 cases of COVID in this state. 200,000 people that have been impacted with COVID-19, and to have someone in a position of power advocating in the other direction is certainly tone deaf and does not shouldn't warrant any consideration by anybody.
And we have said this from day one. You've beat it in all of us. It's not about politics. It's about life and safety. I remember a couple weeks ago I had the bowl of candy here. We had a comment last night. Well, 97% of those who get it recover. And I still want somebody, and when I put those 3 pieces of poisonous candy in there, I want somebody to come and pull them out of there, because I'm not willing to gamble. And if you're willing to gamble on your family and your friends, that's on you. But I got to believe that the majority of the people in St. Clair County don't want to gamble that way. 97% recovery rate, but those 3%, and as I said now, 158 of our county residents don't have that choice anymore. 158 of those, the majority of them, died in the hospital or in long-term health care facilities with no family members, with strangers with them. And for those of you who went through that, I just had 2 families recently. My sympathy goes out with each and every one of those 158 families, because that's got to be terrible. When they were in the hospital, you couldn't go and see them. And if we want to go backwards, then don't wear your mask. That is stupid if you don't. And I'm going to leave it at that. We'll be back shortly with Cindy and Daisy to translate this into our Spanish community, and then we'll be back tomorrow afternoon. Hopefully we're going to have Dana from mental health on, and then next week we're going to have a pediatrician come on. We've had a lot of requests for that with schools and that all starting back up. So we'll be back tomorrow afternoon with our briefing and some more information. Thank you and have a good evening.